Welcome to the Joint Replacement Program at Texas Orthopedic Hospital. For years, our hospital and our surgeons have been providing top-notch orthopedic care for the Houston area and beyond. Our surgeons have trained at top institutions and have maintained board certification and are up to date with the latest surgical techniques and surgical skills. We practice cutting-edge orthopedics at TOH, and our hospital rankings and complication rates are among the best in Texas and the nation. Fast-track total joint replacement is a very popular term these days, and something we've been doing for years. In fact, our program has been geared toward rapid recovery and short stay for patients for a long time. Even if a patient is not interested in a fast-track program, we find that all patients benefit from a quick recovery and a short hospital stay. And scientific studies agree with this and have shown that the better we educate you about the surgery, as well as cut down on your risks and side effects with our techniques, then the better you'll do. By now, you've most likely visited with your orthopedic surgeon in the office at least once and maybe more times. At that visit, the orthopedic surgeon and their assistants have spent time with you and answered many questions. Another helpful way to learn more about surgery and recovery is to attend the preoperative joint class at Texas Orthopedic Hospital. Thousands of patients have found this class helpful, and the feedback that we have received has been excellent. At this hour-long class, you can spend time with a therapist and the social service teams who will introduce you to the recovery process and what to expect after surgery. This includes schedules, exercises, equipment, and activities. Most importantly, they do an excellent job answering your questions. Seeing and learning ahead of time is very helpful, so please follow us on our tour. This is the registration area and waiting room. When you have first arrived at the hospital, you will come here to the second floor to register. This process has been streamlined and things move pretty quickly. Shortly after this, you will be taken back to the surgical preoperative area. Immediately inside the registration area is the preoperative holding area. Here, you will meet your preoperative nurse, who will get you into a gown, go over your history, go through some last-minute paperwork, and get your IV started. Hi, Mrs. Smith. How are you? You will then meet your anesthesia team, including your anesthesia doctor. Finally, your surgeon will come by to greet you, answer any last-minute questions you may have, and then the surgeon will sign your operative site. We'll get you back there soon. After your time in the pre-op area, you'll be taken to an operating room just like this one, where you'll find a whole team of people focusing all of their attention on you, the guest of honor. Surgery for a routine joint replacement is done quickly and efficiently, performed by your team of doctors and nurses and technicians who've done this thousands of times. Our surgeons and their anesthesia colleagues have come up with a cutting-edge program to, first of all, perform your surgery minimally invasively, minimize the amount of trauma and bleeding during and after surgery, cut down on the amount of postoperative nausea and sedation, and minimize the pain after surgery. The quiet area behind these doors is the recovery room, where you will visit after your surgery is over. Here, you're monitored for a while until it's safe to send you up to your room. While you're here, your doctor will have spoken to family members or friends to tell them how surgery went. Finally, you've made it to your private room, where nurses and aides will focus on you and where you'll be reunited with your family members and friends. Pretty soon, after your arrival to the floor, the physical therapist will come by to assess you and begin therapy. Your path to a quick recovery began with your minimally invasive joint replacement, but will now continue. Scientific studies have shown that immediate mobilization, such as getting up on the same day of surgery, is good for you and cuts down on complications. Whether you choose to be a fast-track patient or not, and whether you plan on one night in the hospital or more, early mobilization is generally the rule. If you choose to be in the fast-track program, then you'll be seen by the therapist twice on the day of surgery. Hopefully, if you've attended the total joint preoperative class, things won't seem so new and you'll move along quite quickly. On the day after surgery, the therapist will come by again and you should be ready to go. If you're not, then there's no rush, as we want to make sure you're safe before you leave the hospital. As you may have gathered from this video, Our program is streamlined and focused on you, the patient, and your journey through joint replacement. At the Texas Orthopedic Hospital Joint Replacement Program, we strive to provide world-class joint replacement care with a fast and safe recovery. If you have any questions, please contact your physician or give us a call.